Okay. Great. Okay, the AHA cream is not for everyone. So this cream, it's a night cream only, of course, because it contains a glycolic acid, 5%. It's gonna be very good for all your rough skin textures, your dull complexion clients. So of course, it's not good for oily skin because it is very also hydrating because it contains shea butter. So it's going to be good for mature, dry, but dull skin. You know, the skin like that is a lack of glowiness. It's going to be very like dull, but it's also mature. So I'm pretty sure you have a client popping in your head. So this is very the kind of cream that's going to help them see results and have a very a more like clear skin. So it's a very nice product, but sometimes we forget about it because it's more like specific. So all your mature skin that's going to be a bit dull, that needs a bit of brightening, is going to be good for them. So it's a night cream, exfoliating and anti-aging, and also very brightening, as I said, because it's 5% glycolic acid. So it's like not a small peeling because it's like very small quantity, but it's like, it's going to exfoliate the skin during the night. Very good to reduce also the large pores for the mature skin. You know, sometimes you have older clients, but they still have very large pores. You can recommend this cream to them as a night cream. So it contains 5% glycolic acid, shea butter, panthenol, squalane, and cypress essential oil. Then we go in the last category with anti-aging and repair. So just for you to know, we're working currently on new products. So we're very excited. I think by this fall, we're gonna launch new products. So if you have like, if you want to give your opinion on new products you think we should add, feel free to tell me because it's very interesting to know what you guys think. So anti-aging and repair, it's a category for the anti-aging and the repair. It is very good to like frame the high-tech treatment to make sure your client use the right product right after their treatment. So I'm gonna start with the regenerating cream. Oh. Sorry, I don't know. Okay, now you see my screen. Are you able to see my screen?
Yeah.
Okay.
Yes, we can.
It just stopped. Okay, so the regenerating cream is a very good cream, a night cream for redness, sensitive skin, dehydrated skin, cuprose, telangiectasia, rosacea, and all the very sensitive and red skin. This is a night cream. It's gonna fortify the skin. It's very good also for clients who's gonna do IPL or everything to promote their redness. So it's made of a cocktail of peptide. That's why it's a very good night cream for all like more sensitive skin, as well as very anti-aging and moisturizing. So you're gonna recommend this cream as a night cream for all your sensitive skin, but also all your skin that wants a great moisturizing effect, though, so that like rich texture. So it's kind of rich. So it's made of high and low molecular weight hyaluronic acid. It has a cocktail of peptide, as I said before. It also have caffeine and a stem cell protector. So this is a very fortifying cream, very good night cream for all your mature skin, dehydrated skin, a bit more sensitive skin. That's not gonna want to treat like a specific, except redness, a specific like disorder. So if it has like large pores, it's not really the cream for them. If it has pigmentary disorders, it's not going to be the cream for them. But really redness sensitive, anti-aging, a lot of dehydration. This is for the regenerating cream. So it's a night cream. So for example, if you have, I always like to make example like that because I think it's more easy to like recommend products after. So if you have a really red skin client who's doing IPL to reduce the redness, you can recommend them the redness kit, who's going to contain all the products they need. But if they just want 2 products, let's say a daily cream and a night cream, so you're going to go with the protective day cream for the day, because I'm pretty sure it's going to be normal to dehydrated skin. So if it's very dehydrated and mature, you can go with the ultra protective. And if it's oily, you can go with the fluid. But usually for a sensitive dehydrated skin, you're going to go with the protective day cream in the morning and the regenerating cream at night. So it's going to improve the skin sensitivity and make sure it has the right amount of moisturizing. Next, we're going to go with the Dermo Repair Complex 1. I'm not going to put a lot of time on that because I don't think you have CO2 or erbium YAG yet or stuff like that. So basically this cream is to mimic the effect of a real skin. So right after a procedure like ablative laser, or very dehydrated or irritated skin right after a like very ablative procedure, as I just said, you're gonna apply this cream and it's gonna like protect the skin, give a sorry, I'm losing my words. It's gonna mimic the skin effect on the skin, so it's gonna protect and give like a layer of glycofilm, sorry. So it's made of glycofilm. So it's like if you apply something on your skin to protect from all the environmental aggression. So right after a very ablative treatment. And you could have it at your clinic. I don't think it's going to be the more appropriate cream for your clients, but you could have it only like a little bit for your very sensitive and very irritated or very dehydrated skin. So I saw a girl the other day, I did a training at another clinic, and she was like telling me that she had bad eczema. And usually when it's bad eczema, we recommend the regenerating cream and maybe the soothing gel as well. But she was saying that the only thing that saved her skin was the Dermo Repair Complex 1. So you see that it's very for like very dehydrated or very irritated skin.
It says it's also really good for tattooing and tattoo removal. We have tattoo removal.
Okay, sorry, I didn't know that you had. Yes, so it's very good for tattoo removal. So right after you're gonna do the tattoo removal procedure, you're gonna apply this Dermo Repair 1. That's gonna help repair the skin. That's gonna give the right amount of hydration right after that kind of treatment and protect the skin in the healing process. So instead of putting, I don't know what you put, usually maybe Vaseline or something like that, but instead of putting that, you're gonna put the Dermo Repair 1 that's gonna really active the healing process. And you can, so when you do tattoo removal, which is very nice, is that you can, as soon as you recommend a cure of tattoo removal, you recommend this cream for the whole cure because they need to apply it at home to make sure the healing process is done correctly. And you can also recommend the Dermo Repair Complex 2 that I'm going to talk to you about right after. This is the step 2 of the healing process. So once your scars have like started to heal, you can continue with the Dermo Repair 2. That's going to continue with the scarring process, continue to protect the skin, continue to help healing of the skin. So this is the first step of the tattoo removal post-treatment. Glycofilm 5%, this is the skin effect that you're gonna have on your skin. Beta-glucan and ceramides. Ceramide is gonna be good for the renewal of the skin. And also it contains high and low molecular weight hyaluronic acid. So this is for the dermal repair complex that you're gonna recommend for the tattoo. Next, we have the dermal repair complex 2. So the dermal repair complex 2, first of all, as I said before, is the step 2 of a healing journey right after really invasive procedure as tattoo removal. So if you're doing tattoo removal, usually the best scenario is that they leave with the dermal repair complex 1 and the dermal repair complex 2. So right after the procedure, you're gonna apply the dermal repair complex 1 right under the skin. So you have a professional size for that. And then they're gonna leave with a resale size of dermal 1 and dermal 2. So the next few days, they're gonna apply only the dermal 1 all the time, morning and night, just to make sure it's always hydrating. It's always keeps the hydration to make sure the repairing of the skin, it's in a good healing process. And then after, once they finish this dermal repair complex 1, they're gonna apply the dermal repair complex 2. So this is to continue the healing process of the skin, make sure it scars correctly, so to help restore. So let's say you do so in tattoo removal, usually you do a cure, right? So you're gonna do what, 12 treatment, around 12 treatment, if I'm not mistaken. So what you're gonna do is that the client will leave with his two, the dermal 1 and the dermal 2. And in the few days right after, so 2 to 3 days, always apply dermal 1, and after go on with the dermal 2. So I'm pretty sure the dermal 1 and the dermal 2 will last a long time for the whole cure. Not if it's a very big tattoo, but if it's a small tattoo, usually it's gonna last for a bit. So it's gonna be a very good post-treatment care to use the dermal 1 for 1 to 2 to 3 days, and then after up to
Megan,
yes,
wouldn't this be a good treatment for after Pico?
So this, yes, the dermal 2, but not the dermal 1.
Not the dermal 1, yeah, okay.
So I'm gonna explain why. So basically the dermal repair complex 2, right after Pico, is gonna be your go-to. It's also gonna be good for right after microneedling treatment. Why you're not gonna recommend the dermal repair complex 1? You could, but usually if you're doing Pico or microneedling on a very, on an oily or mixed skin, it's not going to be good because the texture is too rich for that kind of skin. So there's a good chance they're going to have skin eruption. But with the dermal repair complex 2, even if it's a rich texture, it has silver, purified silver, that's going to be very antibacterial as well. So it's going to prevent all kind of eruption. So after the Pico, you can go with the dermal complex 2, and you can also go with the dermal repair complex 2 with the microneedling. So it's a non-occlusive formula. So it's the difference with the dermal repair 1 that it's going to be occlusive. So that's why you're going to use it on tattoo removal, but not on facial skin who's doing like an ablative procedure. Is that like clear? Should I explain more?
That's good.
It's good. Great. So the dermal repair complex 2, also you can recommend to all of your clients that's going to do treatment for scars, renewal of the skin. So you're going to recommend the dermal repair 2 as the night cream. So basically it's made of ceramides, purified silver, tranexamic acid, and niacinamide. if you know all these ingredients, this is to promote the healing and a good scarring process. It's gonna help with the scarring issues. So for me, for example, I had bad acne when I was a little bit younger, and then I did a lot of microneedling. So I would use this as a night cream for a long time, and I still use it sometimes. It's a very rich texture, but when you do a cure of treatment to help with your scars, it's very good to use it at night. Also, you're gonna recommend this for all your clients that are gonna do non-ablative laser. So for example, Nella, you have the Pico, do you have the 1540, so the icon?
No, we don't.
So you have the Pico
We
and
just have the Pico, yeah,
and the micro.
temperature, yeah, just Pico and temperature at this point.
Okay, great. So for the Pico, it's gonna be your go-to for right after the treatment. You recommend to your client to apply this every night during their cure, and same thing for microneedling. So you can recommend this for all of your clients that's working also on the anti-aging and scars. So this is for the dermal repair complex 2. I hope it's clear. If you have questions right after, feel free to email me or just text me, because I know sometimes it can be a little tricky, the difference for the dermal repair 1 and the dermal repair complex 2. But basically the main difference is that the dermal one you're going to use for, it's going to be more occlusive for very like ablative procedure as tattoo removal. And the dermal repair complex 2 is going to be for all of the treatment it's a little less ablative. So Pico and microneedling. Okay, now we have the Lift Eye Contour, is the last product of this category. The Lift Eye Contour, it's a very nice product for all your blue-ish eye contour. It's very good also. It's a very anti-aging and lifting effect for all the eyes area, so all the wrinkle, fine lines, and also around the lips. So you have a lot of clients, when they age, they're gonna get a lot of wrinkles around the lips and here around the eyes. So it's gonna help with that. It's very good to recommend when you're doing a temperature cure. So it's gonna like help with the results. Also, your client will see more results because it's gonna have a routine that's gonna help with their treatment. It's also a very good treatment for puffiness under the eyes, and very antioxidant and moisturizing. Also, my mother, for example, she uses it everywhere on her face, everywhere on her neck, because it has very high concentration of hyaluronic acid. So it's a very lifting effect. So for your all more mature and dehydrated skin, it's a very good also like to be used as a serum as well. We're working those, so this is a scoop. We're working on the anti-aging serum right now. So it's gonna like be a lot alike of this product, because this product is very good as a serum as well. So the texture is a bit different of the other eye cream. The other eye cream is a creamy cream, and this one is a zero gel. So it's just the texture that's gonna be a bit different. The other one is in a pump. This one is in a pipette. So it's 5% hyaluronic acid, and it has a cocktail of peptide. Peptide is very good for healing. It's very good for anti-aging, very good for renewal of the skin. So that's why it's a very, very nice product. So last, we're gonna talk a bit about the kits, because I think, Nella, you have some of them. So basically the kits are made to frame a dermoaesthetic treatment plan or for daily use as needed. So basically these are the 3 months post-care kit. So it contains all the product your client needs at home to improve the results of their cure they're doing with you, their plan they're doing with you. And also it's a very good complete routine. So basically if you have a client that doesn't want like that really don't know, that don't have any products, I just want like a simple routine, you can recommend a specific kit. They have all the products they need in the kit. They also have an explanation card in the little kit that's going to explain all the steps they need to take at home. Very simple for you, very simple for them, and you know they're using the right products when they do treatment with you. So first we have the 3-month kit. So we have the oily skin kit first. So the oily skin kit is for acne prone skin, all the skin that's gonna have a lot of excessive sebum production. It's a very good kit for them. It's gonna contain a cleanser, a soothing gel, the protective day fluid. So it's the daily cream that's gonna be gel cream. And the AHA BHA lotion, as we talked before, is a salicylic and glycolic acid lotion. So it's a night only lotion. It's very important that they clean their face in the morning and apply their fluid. So it's a perfect kit for me. It's a perfect kit for all your acne prone and oily skin type. Redness kit now. So if you're treating in a purifying peel, IPL, you can recommend this product, this kit. The redness kit then, if you're doing pico or any kind of treatment to reduce the redness or sensitivity of the skin, this is the kit for them. Also, if you have a client that want a complete routine and you see that has a lot of redness on their skin, copros, telangiectasia, rosacea, and all stuff like that, you can recommend this kit. So it has the cleanser, the soothing mask. As I said before, it's very good for redness to do once or twice a week, the protective day cream for the daily cream, and the regenerative cream. Next, you have the skin resurfacing kit. I'm not gonna like explain it to you because it's for the CO2 or MYRIADE. You could recommend to your mature skin for pico. So I know for the tattoo removal, but usually they don't need all of these products for the tattoo removal. But if you would do a pico treatment on the face of a mature skin, you could recommend this kit because it has the dermal one. It's going to be too rich for oily or mixed skin. It's going to break out. But for a mature skin, it's perfect. So you could recommend this. The pigmentary disorders kit is very good for all your clients. You're going to treat dark spots, pigmentary disorders, or any treatment that's going to help with the brightening of the complexion and uniformity of the complexion. So basically it contains the cleanser, the soothing gel. The soothing gel is in every kit. Why? Is because it's the SOS gel, the perfect SOS gel. Also, it can be used as a serum. So you're going to apply this before your daily cream and before your night cream. It's going to help with the healing process of the skin, reduce all inflammation. It's also antibacterial and moisturizing. The protective day cream in the morning, and the C-retinol. So the C-retinol is the cream, as I talked before, that's contained 0.5 of retinol and vitamin C. It's going to help with the pigmentary disorders, and it's also anti-wrinkles. And last, you have the repair kit. So the repair kit is very important for you because it's a kit that you're going to recommend a lot, I think, for all your pico treatment. So it's going to really promote the healing right after a pico treatment or microneedling, or even you could recommend this kit for a temperature. It's not going to help like a lot with the healing process because you don't have really a downtime with the temperature, but it's going to promote, it's going to bring great results for anti-aging treatment as temperature. So basically it contains a cleanser, the soothing gel that you're going to use right after pico, not right after, but during the next few days when you feel irritated, you feel redness on your skin, you feel sensitivity on your skin, you can put the soothing gel. It's going to really like soothe the skin. The protective day cream going to protect the skin during the day, and the dermal repair complex 2, which is going to promote the healing right after a pico treatment and improve the results of pico treatment. So yes, this is for the repair kit. It's also a very good anti-aging kit. So if your client just want a full kit of anti-aging products, you can recommend this to them, full size of products at home. This is all for the 3 months. The 3 days kit, so this is for gift discovery travel kit, or first days following various treatments. So basically it's for all cynosure technologies, but the only thing, it's a very small quantity of product. So it's very for a few days right after the treatment. It's not gonna like, they're not gonna see results with that, but it's gonna help like right after to make sure they use the right products and make sure it really like suits the skin. So you could recommend this to a client that doesn't want to have the full 3-month kit, doesn't want to pay for like a more expensive product. So you're going to be sure that they use the right product right after their treatment. But yeah, so it's small quantity. So you have normal skin kit, the oily skin kit, and the skin resurfacing. So basically the normal skin is going to be for post pico or post microneedling for the normal skin. And the oily is going to be for the oily. So the only difference in the oily, there's the protective day fluid, and in the normal, there is the protective day cream. So this is the only difference between those two. And the skin resurfacing kit, so it's going to contain the cleanser, the ultra protective, the dermo 1 and the dermo 2. So basically, if your client's doing tattoo removal, doesn't want to buy the whole dermo 1, dermo 2, you can sell them this small kit who's going to contain all the products they need to apply on their skin right after their tattoo removal, or for mature skin right after a pico. So this is for that. Is it clear for the kits and all the products we've talked before?
Yep.
Great. So now, Nella, did you bring in the clinic the peelings?
Yes, we do. We have both peels.
Okay, so we're going to talk about a little bit.
Yeah.
Okay. So we have 2 peeling in Concept Myriad. The first peeling is the brightening peeling, which is 30% of phytic acid. You're going to recommend this peeling for all your client who wants to work on anti-aging, so fine line, wrinkles. But of course, it's not the main treatment to treat wrinkles, but it's a very good preparation before pico or before other treatment that's going to help with the anti-aging. So this, you're going to recommend this product, this treatment. So you can do as pre-procedure before doing a cure of pico. It's going to be sure, like it's going to make sure that the technology go more deep into the skin. And also it's going to help with the pigmentary irregularities, pigmentary disorders. So this is to treat melasma, pigmentary disorders, and superficial scars, and before treatment as pico to treat wrinkles and fine line. So you're not going to see results on fine line and wrinkles. Even with a cure, it's not the best treatment to see a bunch of results. You're going to recommend pico because it's a technology, so it's going to go deeper. But to prepare the skin, it's a very good treatment. But for the pigmentary disorders, it's a very good treatment as well. So what you're going to do with the phytic acid is that you're going to do a cure of a 4 to 6 treatment if you want to treat pigmentary disorders or melasma. So this is for the phytic acid. The other product, the other peeling is the salicylic acid. It's 10% of salicylic acid. So this is the peeling for acne, large pores, comedons, acne rosacea, everything that is about the texture or the bacteria of the acne, you're going to treat with that, and it has amazing results on acne. I did it on myself. I did it on clients. I have a lot of clients that use this on acne, and I think it's one of the best solutions to really treat and control the acne bacteria. So you can offer a cure of 4 to 6 treatment as well. The interval between the treatment is 2 to 4 weeks. So if the skin reacts like normally very okay, you can go 2 weeks, 2 weeks. But if the skin is more sensitive, reacts a lot more, then you're going to go to 4 weeks between the treatment. The only difference between the salicylic acid and the phytic acid is that the salicylic acid is going to neutralize by itself. So when you apply it on the skin, both of them, you're going to clean the skin. You're going to apply the peeling everywhere by doing like this with your gauze. So you're going to apply everywhere by doing like kind of a good pressure to make sure the product goes deeply in the skin. Everywhere. You can continue to press on the skin everywhere until your gauze is evaporated. But the only difference is the purifying. You're going to leave it on the skin until your client doesn't feel any tingling anymore. Then you can rinse, apply the mask, apply the gel. But with the AHA, what you're going to do is you're going to set a timer for 3 to 5 minutes. The maximum is 8 minutes that you can go with the AHA. So basically, you're going to clean the face, apply the peeling, leave it on the skin. For the AHA, it's 3 to 5. For the BHA, until the client doesn't feel any more tingling. Then you rinse it off. For the AHA, it's very important to rinse 3 to 5 times because the water is going to neutralize it. So the AHA is the phytic acid. You're going to rinse it 3 to 5 times. And the BHA, you can just rinse it once because it's going to neutralize by itself. Then when it's neutralized, you can do a second layer, or if the skin has reacted a lot already, just do that. And then you apply a layer of soothing gel to soothe the skin. You apply the soothing mask for 10 to 15 minutes. You leave it on the skin of your client. And then you're going to rinse the mask. You're going to apply the finishing cream, so the daily cream. So for oily, fluid, or protective day cream. So is the procedure kind of clear? I know it's very easy, but it's important to really, I think the most important thing is to use your judgment. So if you can do a second layer. And the other thing is to really press on the skin with your gauze. Because if you don't press enough, the products won't go deep enough, and then you're going to see less results. Also very important to have eye protection. So little goggles, just to put it on the eyes so the products don't go into the eyes. Also the step by step, if you forget about it, it's all in your clinical manual. So you have all the steps. Step 1, clean the face. Step 2. So it's very easy procedure. The only thing is you need to use your judgment. So if you can do a second layer or not. And also if you need to, how much treatment you need to recommend. Usually it's 4 to 6. The more you do, the more results you're going to see, of course. If you want to do a preparation before laser treatment, you're going to do the peeling once or twice. Then you wait 2 to 4 weeks before the laser. Usually 2 weeks is going to be good. But if the skin reacts a lot during the peeling, then you need to wait 4 weeks to make sure there's a whole healing process. And then you can start with the pico. So this is for the peeling. Is everything clear with the peeling?
Yes.
Yep. Great. And the last thing I want to talk to you about is the microneedling. So I don't know if you have it yet, but if you bring microneedling into the clinic, then you can use the microneedling serum that's going to be made of high and low molecular hyaluronic acid, concentration of peptide and plant stem cells. So it's going to activate the anti-aging and repairing of the skin and strengthens the skin structure. So it's a microneedling serum to be applied during the microneedling treatment.
So we don't have microneedling.
Okay. So
Megan, but
yeah.
Is this a non-sterile ingredient like product because you're applying it right after microneedling?
You apply it during. So yes, it's a sterile product.
It's sterile. Okay.
Yeah. This for that. So I'm done with the whole product explanation. Do you have any question? I know there's like a time sensitivity, but if you have question, I can also answer by emails. And if you want more explanation, we can also set up an individual call if you want like specific question.
Could you give your email and number?
Yeah, of course. So my email, I'm gonna write it in the chat so you can all see that. Can I? I think I can, yeah.
Also, Megan, if you can tell them about that group, I didn't send it to them yet. Just tell them a little bit about the
Okay, so I did a group.
Affiliates, yeah.
So I did a group that is for the affiliated clinic. So you can ask whatever question on that group. I'm gonna send also a lot of information regarding the line and the products. There are also gonna be explanation videos and a bunch of promotion that you can talk to your client about. All that kind of stuff is gonna go on this group. It's a Facebook group. So I'm gonna send the links to Nella and she can send it to you. You can all join.
Did already, so I just sending it now to them.
Perfect. So you can all ask to join the group, write the clinic you're at, and I'm gonna accept your request. And then you can join it, and I'm gonna post a bunch of information. It's a very important tool, I think, because you can also ask me questions and comment and share everything. So I think we're done. So I'm just gonna thank you for your time. I hope everything was very clear. If you have questions, don't hesitate to text me. I also put my cell number or email. And so I wish you a lot of luck with your new treatment, and everything's gonna go very well. And that's it. Thank you for listening.
Perfect. Thank you.
Thank you so much. Thank you.
Thank you. See you soon. Bye.
Thank you so much.
Thank you.
Thank you.
Okay, so you can stop recording and then you're gonna send it to me?
Yes, I will.
Thank you, Megan. That was great. It was
Thank
totally
you,
needed.
Nella.
Yeah. Thank you.